When you think about the concept of a medical diagnosis, there is this inherent expectation of precision.
Oh, absolutely. It's
Yeah.
almost like engineering in a way.
Right, like you fall off a bike, your arm hurts, the doctor takes an x-ray, and there's a jagged white line on the film.
Right there in black and white.
Exactly. The doctor just points to it and says, there is the problem. Your bone is broken, so we need to fix it. It's binary. It's objective.
And in a strange way, it's deeply comforting,
It really is. I mean, we naturally like things to be visible. We like our human experiences to be easily categorized into neatly labeled boxes of healthy or unhealthy.
You want that certainty.
But the moment you step out of the emergency room and step into the world of mental health, especially when it intersects with personal identity, that X-ray machine is suddenly just entirely useless.
It really is.
The diagnostic landscape we're looking at is murky, it's complex, and it constantly challenges our basic assumptions of what it actually means to, treat someone.
Yeah, it forces a complete reevaluation of what the words symptom and cure even mean.
Exactly.
We're no longer looking at a jagged line on a bone. We're looking at human distress and trying to trace exactly where that distress originates.
Which brings us to the core mystery of our deep dive today. I'm your host, and today we're looking at a very brief but incredibly dense piece of source material.
I'm really looking forward to unpacking this one.
Yeah, so it's a service overview and philosophy statement from a healthcare provider in Georgia called Coping and Healing Counseling, or CHC.
Right.
The document is officially titled Affirming Gender Dysphoria Care and Telehealth Services. And our mission for you today is to impartially explore the specific framework and messaging provided in this text.
Just to see exactly how they approach this.
Exactly. We are examining how this clinic defines its care, its views on gender dysphoria, and its operational model. We're just unpacking the ideas precisely as they are contained in the text.
Right, because we really want to understand the philosophical and practical message they're communicating to prospective patients.
Yep.
And that involves looking at not just what services they list, but the specific language they choose to describe those services.
Oh, language is everything here.
In modern healthcare, the terminology a clinic uses acts as a very clear signal of their underlying clinical philosophy.
Exactly. I mean, when I was going through this text, it struck me that reading a clinic's introductory literature isn't just about reading a menu of services.
No, it's much deeper than that.
It's more like looking at the foundation of a building. It doesn't just tell you what they do on a day-to-day basis. It tells you exactly what kind of pressure they expect the building to withstand.
Right. Who they're trying to shelter inside it.
Exactly. And why they felt the need to pour that specific foundation in the first place.
That's a great way to put it.
But framing this whole deep dive around this paradox of treating something that isn't a disease, I mean, can a single paragraph of healthcare marketing actually reveal a broader shift in how we understand the mechanics of mental health?
It absolutely can, and I think this text is a perfect example of it.
Yeah.
What we have here is a synthesis of modern clinical psychology, healthcare logistics, and social dynamics. And it's all compressed into one concise pitch.
Wow, okay.
It's a very specific articulation of a philosophy of care that actively challenges older medical frameworks.
Okay, let's unpack this because before any clinic can treat a patient, they have to define what they are actually treating.
Right. What's the baseline?
Exactly. And the source text starts by explicitly busting a myth. It states head-on that being transgender or non-binary is not a disorder, and it is emphatically not something to, quote, fix.
And that distinction is the foundational pillar of literally everything else in the document.
Interesting.
They are intentionally separating a person's identity from the concept of pathology.
Right. The text states that the clinical diagnosis they use is gender dysphoria, but it clarifies that this diagnosis only describes the distress someone feels when they're assigned gender at birth, doesn't align with who they truly are.
The distress is the key word there.
Yeah, exactly. The diagnosis exists, according to the text, for one specific reason so people can access affirming, respectful care.
Right.
To me, it's like distinguishing between being left-handed in a right-handed world versus the severe hand cramps you get from being forced to use right-handed scissors all day.
I love that analogy.
Right. The left-handedness isn't the disorder. There's nothing wrong with the hand itself.
No.
The painful cramp from the friction with the tool is the issue.
And the clinic is stepping in to address the cramp while totally validating that the hand is functioning exactly as it should.
But, I mean, it feels contradictory to me. If being left-handed is perfectly fine, if the identity itself isn't a disorder slapping a clinical diagnostic code on, It feels like you are inherently pathologizing the person, regardless of what the brochure says.
Sure, it can feel that way.
Why does the source insist on keeping a clinical diagnosis like gender dysphoria at all if they believe the person doesn't have a disorder?
Well, what's fascinating here is how the text frames the diagnosis purely as a functional
That's
tool.
all.
Yeah, it's essentially a medical key.
Yeah.
Imagine you're trying to navigate the modern healthcare system. You know who you are and you know you need support.
Yeah, okay.
But the massive bureaucratic medical infrastructure is demanding a specific diagnostic code before they'll even open the door.
Oh, I
You
see.
cannot unlock insurance coverage, you can't get referrals, and you cannot access specialized therapeutic care without that code.
So it's just a pragmatic reality.
The clinic is definitely acknowledging that harsh reality by explicitly stating in their literature that the diagnosis describes the distress and not the person. They are fundamentally shifting the medical gaze.
So they are looking at the friction, not trying to rewire the patient.
Precisely. It
Yeah.
shifts the gaze entirely away from curing the person to simply alleviating their distress.
Right.
They are implicitly telling the prospective patient, we are forced to use this diagnostic label by the system to get you in the door and get your care covered financially, but we do not view you as intrinsically disordered.
Wow, okay.
It's a highly pragmatic navigation of the medical system's rigid requirements while, maintaining the psychological safety of the patient.
Here's where it gets really interesting, though. If we accept the source's premise that the diagnosis is solely about the distress, we have to look at the mechanics of where that distress is actually coming from.
Right. What's causing the friction?
And the source makes a very clear, very specific argument about the origin of that pain.
It points firmly outward rather than inward.
Yes. The text states that the distress of gender dysphoria, quote, grows heavier under the weight of others' judgment.
That's a powerful phrase.
It is. It's framing the problem as an external weight pressing down on the individual. And because of this continuous external weight, the text says anxiety and depression frequently accompany the dysphoria.
Which logically connects to the specific roster of services they offer.
Oh, yeah.
If you identify the root cause as an external weight, well, your treatments have to address the psychological consequences of carrying that weight.
Exactly. When you look at the list of specialties CHC provides, it's a direct one-to-one correlation to the effects of that heavy burden.
Let's hear them.
They explicitly list anxiety, depression, trauma, and PTSD, grief, relationships, and stress.
Yeah, all reactions to an environment.
It really seems like they're treating the physiological and psychological symptoms of societal friction, not an internal medical failure.
All right.
Going back to our analogies, it's like treating a patient for a severe sunburn. The sun representing that relentless societal judgment caused the burn, which manifests as the anxiety, the trauma, or the depression.
Exactly.
The person's skin isn't inherently flawed or broken for burning when it's exposed to intense, unprotected heat.
And sticking with that sunburn idea, the source isn't claiming that therapy is some magical sunscreen.
Right, it doesn't block the sun.
Sitting in a session isn't going to suddenly block the UV rays of societal judgment out in the real world. Instead, they are offering supportive care, giving the patient aloe vera, treating the blistering, and providing a safe, shaded space indoors to heal and build up a tolerance.
But if they can't turn off the sun, how does this actually work mechanically? Does the source suggest that a telehealth appointment can somehow make that external weight manageable?
Well, if we connect this to the bigger picture of clinical psychology, the source is offering resilience.
Resilience.
Yeah. The text doesn't claim to cure society or make the judgment disappear because, that's impossible for a clinic to promise.
Of course.
Instead, the therapy is framed as a critical mechanism to help the individual carry that weight without collapsing.
Okay, that makes sense.
It's about building coping strategies, processing the trauma caused by the friction, and providing a safe harbor. They are framing mental health support as a necessary active buffer to protect the patient from what is often a profoundly hostile external environment.
So, what does this all mean for the patient? If the clinic's stated goal is to act as this active buffer against external judgment and internal distress, we really need to look at how the source explicitly defines its treatment methodology.
Right, how do they actually do it?
Because saying you're a buffer is easy, but what does this affirming care actually look like in practice, week to week?
Well, the source gives us a very clear operational definition of their approach, and it hinges on one specific phrase.
It does. It defines supportive care as having a therapist who explores your identity, quote, without an agenda.
That's huge.
It is. It involves steady support through whatever social or medical steps the patient chooses to take or not take. The core philosophy they state verbatim is, you deserve to be seen and supported exactly as you are.
And they apply this methodology across a wide spectrum of formats, right?
Yeah, individual therapy, couples therapy, family therapy, teen therapy for ages 13 and up, plus general life coaching.
Without an agenda are the operative words there, and they carry a massive amount of historical weight in this context.
Yeah. So what does that actually mean for the patient experience? Because to me, it sounds like hiring a tour guide who doesn't actually care which destination you pick on the map.
Right.
They aren't trying to steer you toward the mountains or convince you to go to the beach. They just want to make sure you have enough water in your pack, that you know how to read the map, and that you don't get lost or injured on the way to wherever you ultimately decide to go.
That's a perfect way to visualize it.
But let's be honest, is it strange for a medical provider to explicitly advertise that they have no agenda? Usually when you go to a medical professional, their agenda is incredibly clear. Lower your cholesterol, fix your knee, get your blood pressure into this specific healthy range.
Well, this raises an important question about the evolution of psychological care, specifically regarding gender.
Okay.
In traditional medicine, yes, the agenda is usually a return to a baseline physical metric. But in this specific field, explicitly stating no agenda is a deliberate, highly visible rejection of older, much more rigid models of care.
Rigid in what way?
Historically, psychiatric and psychological care for transgender and non-binary individuals did have a very strict agenda.
What did that actually look like for a patient, practically speaking?
It often looked like a gauntlet. It was a gatekeeping model where a patient had to essentially prove their identity to a skeptical professional.
Oh, wow.
Yeah. They might be required to meet specific behavioral milestones, conform to highly stereotypical expressions of gender, or successfully complete a predetermined timeline of living in a certain way before the therapist would, approve them to access further medical care.
So the therapist was effectively an auditor.
Exactly. By putting the phrase "without an agenda" front and center in their literature, the source is signaling a strict, unapologetic shift to a patient-led approach.
They're completely stepping out of the way.
Right. They are proactively validating whatever path the patient chooses, whether that path involves a full social transition, specific medical steps, a partial transition, or neither of those things. The clinician is entirely removing themselves from the role of the auditor.
The therapist is there to facilitate the journey, not dictate the final destination.
Exactly.
And it's fascinating that they explicitly mention this no agenda, care spans couples, family, and teens 13 and up. Because if we trace the logic back to what we discussed earlier, that the distress is primarily caused and worsened by the weight of external judgment, then getting a teenager's immediate family on board would logically be the most effective way to reduce that friction.
Oh, without a doubt.
You're bringing the people closest to the patient into the shaded room.
It's an attempt to create a microenvironment of acceptance. If the macroenvironment, society, school, the general public is full of judgment and friction, the clinic is trying to build a heavily fortified microenvironment of support at home.
That makes total sense.
By offering family and couples therapy, they're treating the ecosystem around the patient, not just the patient in isolation.
But a beautifully designed, patient-led, affirming philosophy is, well, it's purely theoretical if people can't actually get in the virtual door to experience it.
Right. Access is everything.
Having a great map doesn't matter if you can't get to the trailhead. Which brings us to the logistics, the hard infrastructure of access. How does CHC actually structure its operations to remove the physical and financial barriers to this highly specialized care?
The structural details provided in the text are just as revealing about their mission as the philosophical statements.
Yeah, I thought so too.
They aren't just talking about care. They're outlining a very specific delivery mechanism.
They really are. The text states the practice is 100% telehealth and HIPAA compliant. But the sheer scale of the operation is what caught my eye.
It's massive.
They serve all 159 counties in the state of Georgia.
All of them.
Yeah. And to handle that, they boast a huge team of licensed professionals. They say 15-plus therapists. And they list the credentials, right? LCSWs, LPCs, and LMFTs.
Right. So clinical social workers, professional counselors, and marriage and family therapists.
Exactly. They've gathered a full spectrum to ensure they can cover every angle of care we just talked about. But then you get to the financial access, which is almost always the biggest wall in the American healthcare system.
Absolutely. The financial structuring is where the philosophy actually meets reality.
They explicitly state that Medicaid patients have a $0 copay.
Wow.
And for major private insurances, they list Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, Humana. The out-of-pocket cost ranges from $0 to $40 per session.
That is incredibly low.
They are so focused on access that they put all their contact info right in the overview. The phone number, 4004-832-0102, the website, cheattherapy.com, and the email, support@cheattherapy.com. They want you to know exactly how to reach them the moment you finish reading.
The inclusion of Medicaid with a $0 copay combined with that statewide reach is just a massive operational detail.
Because historically, specialized medical care requires you to go to where the specialists are.
Right. Usually in major cities.
But if you think about physical geography as a bottleneck, using a 100% telehealth model feels like building a massive bypass valve around that entire gatekeeping system.
It absolutely does.
But I'm curious about the mechanical reality of this for the patients. Given how specialized this care is, does the source imply that telehealth is just a modern convenience like ordering your groceries online to save an hour? Or is it a vital necessity for the survival of this specific demographic?
Well, if you look at the compounding barriers that marginalized groups typically face, telehealth in this specific context moves far beyond mere convenience.
Okay.
It becomes a vital mechanism for equity. Imagine you are a young person or an adult living in a deeply rural county in Georgia where everyone knows everyone else's business.
Oh, privacy becomes a massive hurdle.
Exactly. Even if a local clinic existed, the fear of judgment just from parking your car outside could prevent you from going.
I didn't even think of that.
Right. But more likely, a specialist simply doesn't exist in that county at all. Historically, if you lived in a rural area and couldn't afford a reliable car, or couldn't pay for the gas to drive 3 hours to a major city like Atlanta, or you couldn't afford the massive out-of-pocket fees for a specialized out-of-network therapist, you simply did not get care.
The clinic door was locked.
Exactly. The external distress just went untreated, compounding year after year.
So by making it 100% digital, they erase the map.
Completely. By combining a telehealth model that reaches all 159 counties with zero to low copays again, $0 on Medicaid, and capped at $40 on private insurance. This clinic is systematically dismantling both the geographic and financial gatekeeping that has historically defined this field.
That's incredible.
This infrastructure model takes the care, the clinicians, and the safe harbor directly into the patient's living room, entirely bypassing their zip code and their tax bracket.
So bringing this all together, we've spent this time unpacking a single, very dense piece of source material from coping and healing counseling. And what we found beneath the surface of the marketing is a text that fundamentally redefines the problem. It shifts the medical focus entirely away from treating identity as a disorder and focuses instead on treating the distress caused by external friction.
It clearly identifies those compounding external factors, specifically the weight of others' judgment, as the primary drivers of clinical symptoms like anxiety, depression, and trauma.
Right. And to address those symptoms, the document outlines a highly specific patient-led solution. It's an affirming, no-agenda approach that seeks to support the individual rather than audit or direct them.
Exactly.
And finally, to make sure this philosophy isn't just an empty promise, it builds a massive digital bypass valve to deliver that solution across the entire state of Georgia via telehealth and highly accessible insurance options.
It really serves as a comprehensive blueprint for what modern, accessible, and philosophically aligned mental health support looks like when it is designed from the ground up for a specific community.
Which brings me all the way back to that X-ray machine from the beginning of our deep dive. We are so conditioned to want medical care to be visibly binary.
Right, we want to see the broken bone.
Exactly. But this text reveals a model of care built specifically for the murky waters of human experience, where the injury isn't on a scan, but in the friction between a person and the society they live in.
They are building a digital shelter, not to set a broken arm, but to help a patient endure the weight of living in a world that doesn't always understand them.
And that leaves me with one final provocative thought for you to chew on after we wrap up here.
Let's hear it.
It's a hypothetical that builds right off the foundation of this source material. If, as the text points out, the clinical diagnosis of gender dysphoria exists primarily as a functional key to unlock insurance,
Right.
and if a massive portion of the distress requiring that care is caused by the weight of external societal judgment, How might our entire healthcare system need to evolve if society's judgment were to eventually disappear?
That's a huge question.
If tomorrow that external weight of societal friction vanished completely, would the way we structure, diagnose, and fund this kind of mental health care fundamentally change? Would the diagnosis itself even need to exist? Think about that.